what people actually think about IVF. They think of it as injections, scans, and embryo transfers. But some of the most important moments that happen are away from the eyes. It's in the lab where embryologists, doctors, they take care of your eggs, sperms, embryos through a series of precise decisions. But yet, each sample, behind every sample, is a person, a family, and a dream. A dream shared by two becomes a dream shared by entire care team. This World IVF Day, we are going to understand, we are going to go behind the microscope and understand with Dr. Kunjimoideen how precision, how compassion, and how much love is involved in IVF journey. IVF is often described as one treatment, but it is really a chain of precise decisions. So which decisions made early in the journey can completely change what happens afterwards in the lab?
Yeah, in infertility, when we are deciding for IVF, like in any other medical condition, the diagnosis or the crystal clear, sharp diagnosis, that is the foundation of the better treatment outcome. Not the better, the best treatment outcome.
Okay.
In an infertility couple for whom we are planning for IVF, to diagnose accurately, we need a lot of informations, either clinically or laboratory-wise. Clinically, the most important denominator to decide the outcome, that is the age of the couple. Most importantly, age of the female partner.
Okay.
Then for what we are doing for IVF, what is the indication for IVF? What is the actual clinical condition?
Okay.
Then we look at the ultrasound, look at her ovaries, look at her uterus. Then we do a lot of blood tests to decide her ovarian reserve. And for the male partner, we often do the semen analysis. That is the single most important simple test for a male partner. That will tell us his reproductive potential. So based on all these factors, that is the main cornerstone or the points which will lead us to a best diagnosis.
Okay.
Because a best diagnosis will decide how we are going to stimulate the patient, stimulate the woman, stimulate her ovaries to get maximum possible good eggs. And this also will depend on good number of eggs for fertilization and what technique in the IVF, special techniques we need to use in IVF like ICSI or selecting sperm or something like that. And the end of that technology, IVF techniques, is to create the better quality, good quality embryos, blastocysts. And then how we transfer, when we transfer, and what all the medications we use to support it. So all this will depend on the outcome. So diagnosis, that leads to the best outcome.
Okay. An embryo can look very beautiful under the microscope. How much can science genuinely understand from its appearance and what still remains unknown?
See, that's a very interesting question. What everything looks beautiful may not be actually really good inside. So in embryo's case, we generally assess how it looks, of course, under the microscope. Based on that, we grade the embryos. We grade A, grade B, C, the quality wise, and we measure the stages of the embryos. Immediately after injecting the sperm into the egg, that is oocyte, the next day we can see the fertilization, that called the 2PN stage. Then we see the embryos. On day 2, there will be 4 embryos, 4 cell embryos. Inside one embryo, there can be 4 cells. On the 3rd day, there can be 8 cells. And on 5th day, it is called a blastocyst. So each one is graded as per its C under the microscope. The embryos inside the cells will be fragmented, degenerated, lot of spots may be there. So all this will alter the embryo's quality as well as the appearance. But not all good quality or good appearance embryos won't be the same inside. Because there is something, a genetic factor inside the embryo that will be different from embryos to embryos in the same cohort of embryos. And we can even look at that genetic part by doing some test called PGT. We check the embryos before implantation. That is one of the important factor. Next thing, on third day embryo, that embryo should not be at second day stage, or it should be on fourth or fifth day stage. So the speed with which the embryo is forming, that also can be assessed by technology called time-lapse imaging. So these are important, not only the appearance, the genetic composition of the embryo, the quality of the embryo, the speed with which the embryo is developing. These are more important or equally important apart from the appearance of the embryos.
So when a cycle doesn't succeed despite everything going well, what does the medical team and lab team do differently?
Yeah, there are two things in IVF failure. One is that particular IVF cycle which has been failed might be from outside your center. The patient might have done the IVF from elsewhere and came to us. And the second thing is the same couple might have done IVF from our center and it might have failed. Both are actually different. If the couple has done the IVF from our center, we know what all things, 100%, what all things we have done. So we will look at it both on the clinical side and the embryology side. Embryology means in the laboratory side. Laboratory side actually very little things, so little number of things, because they do the same thing ABCD for all patients. They don't have much to alter. They have to look at their quality of the lab and the technique. It has to be standardized, and the consumables and culture media conditions and the types which they use. And the personnel should be, enough number of personnel should be there in the lab. But when it comes to the clinical part, there are a lot of variables, like the age of the patient, BMI, then her body weight, and what drugs we used, when it was used, whether the patient has taken the injections on proper time, and have we got proper response for the injections, have we got the sufficient number of oocytes which are required for creating a successful embryo. A lot of things there. So we will look at all these parameters, whether anything have gone wrong in the cycle which we have done in our setup itself. Second thing, when we analyze the reports of an IVF cycle which has been done elsewhere, we'll look at all these informations can be gathered, because in a discharge summary, it is not possible to give all the informations. Summary means it's a summary of all the informations or a concise report. So we may not get something extra informations which we may ask the patient, and patient's version may not be proper every time. So that time, then according to that, we will look at what we can do differently in the next cycle. Before that, we have to convince the patient, counsel the patient that even the next cycle won't be 100%. Because in the current medical science, IVF do not offer the 100%. So every improvements are being made towards that dream. But we have reached almost 65-70% of beta HCG positive. But we look at it, what differently we can do, how we can change, what all different medicines we can add. What all the different techniques in the laboratory we can do, what all additional treatment modalities, for example, checking the embryo for the genetic compatibility or euploidy status, PGT we can do. Like that, lot of things. There are a group of treatments which have been approved, which have been evidence-based. There are group of treatments which are not evidence-based but practice-based or experience-based. So we do apply both the things so that we'll adopt the things which do not have any negative impact or adverse effect for the patient. So ultimately, all our aim is to have a successful live birth, not just a pregnancy. That couple should be able to go home with a live child. So that is the aim. So the first IVF cycle which has been failed is always an important lesson. Based on that, if we analyze properly, we will be able to troubleshoot it, because that's what actually we are doing.
What begins as dream of two people becomes dream of entire care team. So, how do you think doctors become part of patients' journey?
See, actually, right from the patient selection or right from the couple comes to you for infertility treatment, then you are convincing the couple for IVF treatment. From that point, you are already a part of their dream in their journey towards parenthood. Because initially you are counseling the couple that you need IVF treatment, why you need IVF treatment, how to do it, what are the steps of it. Then the counselor involves. Counselor not only repeats the same thing, they are giving the emotional support. Emotional support is very much required for a couple to complete this journey of parenthood. Then you have your nurse. Nurse will be there because during when you are telling that you have to take injections for 10 to 12 days, there are a lot of people who are scared of taking injections. They are scared of taking a blood test. For this, in spite of they are scared, they have to undergo this for many number of days. So the nurse will support, nurse while giving injections, they will counsel, don't worry, this is something very important for your body, you take care of this, you compassionately address them. And most importantly, the doctor, the nurse, the counselor should be a very good listener. We should not cascade the things very fast. We have to allow this couple to tell whatever their problems, whatever their experiences, whatever difficulties they have come through, or what all challenges they have faced during the previous treatment. So, like we say, the parents should be a good listener. Here, a doctor should be a very good listener to listen to the couple regarding all their issues. So that will solve. Then that time itself, the couple will believe that we are part of them. So they will connect to you often. Then very patiently you have to answer their queries. But considering the knowledge of the doctor will think that these are very silly questions. Why should I answer? Never. For that couple, that's a very big question, very big doubts which we can answer empathetically. So that will actually make you part of the dream project of parenthood. So not only that, during the antenatal period, once they become pregnant, they'll have a lot of queries, then you are again part of the dream project. Once when they are delivered, when they come to you, receive them with a lot of smile on your face, that again will make you the part of parenthood journey of that particular couple. So you are once right from the day of selection till the day of delivery and onwards, you are part of their dream.
So as a doctor, can you share one experience, one patient journey that has been very close to your heart and what made it unforgettable for you?
Yeah, basically this is my 30th year of working in this field and my heart is very large. So I don't have a lot of memories to remember. But because your question is only one option, one choice, I still remember the story of a woman. See, I don't want to tell it as a couple, story of a woman, because in our community, whatever equality you say, whatever you say, there is something which will pull back the woman from the center stage. So here the story of a woman who has challenged all the negative things in the community. During the IVF treatment, she lost her beloved husband in a road traffic accident. A collection was done. The embryos were made, but embryos were not transferred. The woman, that wife, was sitting in the OPD waiting for the preparation of the uterus. Then her husband met with an accident and died. That accident has taken place a little bit away from the hospital. Then she had to stop the treatment. Obviously, she had to stop the treatment. And she had discontinued the treatment for a period of 2 years. Then the connect of that wife with the husband, it was so strong, she doesn't want to get married again. And she wants to have his own child because embryo is here. That I think very rarely the woman or the man, irrespective, any human being, won't think about that thing. They generally think, why should I go behind all those troubles? Shall I get married and have a good life again? She didn't think about like that. She thought, she is an example for all womanhood, I can say. She decided to have that embryos transferred to her uterus, to have his own baby for her. But unfortunately, there was no consent from the husband to transfer the embryos after his death, because they never expect, being a young couple. She went to the court has given permission. Obviously, we also was part of that moment in the court and got the permission. We could transfer those embryos, and she conceived twins, two girl babies, and even the names of these babies, that husband who died, he has even predicted that she is going to have twins. She's going to have two girls. In his diary, he has written the names of the girls to be put. Everything. So that guy also, I think he has unknowingly predicted that he is going to be there. So it's a very traumatic experience, very emotionally challenging experience, but at the same time, very satisfying experience to be part of that journey. And in our society, when two girls, boys may not be that much of a problem, two girls born when the father is not there, the people will tell a lot of things. To counter that, from the day one, she was instrumental in making these news come out through publications. She has kept all those publications ready, so that will be an evidence will speak in favor of her in future, maybe 20 years later, when these girls have to get married or something. So even now, they keep in touch with us. They just send the photos when the girls went to the school, when they are growing up, when they learn dance. So I think that is a very, very touching moment, or a lot of emotionally touching stories are there. But this one, it's quite different from the regular connections. It is actually giving a lot of satisfaction that I have born in this world and I could be part of their destiny, and I could be part of her dream, an exceptional woman to have fulfilled her dream of being a mother, having a motherhood, isn't it? So I'm really happy about that. Even though it was emotionally stressful, at the same time, very happy to be part of that journey.
What happens inside the IVF lab may be invisible to the patient's eyes, but it is never impersonal. Every observation, every decision, every check is important because there is a couple waiting outside.